Good evening. I would like to start on behalf of the Lipedema World Alliance by welcoming everybody to this evening's webinar. It's something I'm personally very excited about, and I know that we're going to have a wonderful discussion. So please do post your comments in the chat as we are going through, and we will be more than happy to pick up all the questions at the end of the formal presentation. I think the Delphi analysis, which Dr. Kruppa is going to take us through tonight, has been a really exciting and rewarding activity for all of the founder members of the Lipedema World Alliance to be involved in, and is something that is really crucial to the way we want to work. So without further ado, I'm going to hand over to Dr. Kruppa to briefly introduce himself and then to start taking us through the content for tonight's presentation. And then, as I say, we'll go into some Q&A at the end of it. And Dr. Kruppa, over to you. Thank you.
Thank you very much, and good evening, everyone. My name is Philipp Kruppa. I'm a plastic surgeon working in Potsdam, very close to Berlin in Germany. And the topic of tonight is the Lipedema World Alliance Delphi consensus-based position paper on the definition and management of lipedema. I will present first interim results. During my everyday work, I focus particularly on lymphedema and lipedema. And despite this, I have nothing to disclose for tonight. Sorry. To reshare my screen. Yeah, now it's working. So during my everyday practice, I ask myself, at the beginning of my career, I asked the question that everyone who works with lipedema will ask sooner or later, what is lipedema? And this is a question that we have also asked ourselves in the LWA board, and we've ended up far too often with a brief description of the Lipedema Foundation. It is not normal fat. And if you take a look at the excellent overview of various guidelines and consensus documents compiled by the Lipedema Foundation, you will notice some very important discrepancies. And the problem is that current guidelines and consensus documents largely refer to the care situation in individual countries. And this also means that despite the existence of good guidelines and consensus documents, there's still a great need for standardization in clinical practice and in research. So what we did was we identified a number of problems. First, we face inconsistent diagnosis across the different regions. And the variability in identifying lipedema leads to different diagnoses depending on the country, which complicates the global understanding of the disease lipedema. In the next step, we encountered varied treatment plans. The lack of standardized care results in diverse treatment approaches, making it very challenging to establish a universal accepted protocol for managing lipedema. This inconsistency further leads to, patient confusion. Patients receive conflicting information about the condition, which makes it very difficult for them to fully understand and manage their health problems effectively. And finally, ultimately, these issues pose a significant research challenge because the difficulty in comparing studies and outcomes across different regions and treatment methods hinders progress in understanding and in treating lipedema. To address all these problems, we are in the process of developing a position paper on lipedema using the so-called Delphi technique. And briefly, the Delphi technique is a method for achieving consensus or informed judgment on specific issues. It is widely used in a variety of fields such as business, defense, education, and also in medical research. How does a Delphi technique work? It's a structured process that involves multiple rounds of questionnaires to gather specific information. And after each round, the responses are summarized and a new questionnaire is created based on the previous round's feedback. This process can be repeated until a consensus is finally reached. The Delphi technique ensures anonymity, allowing for unbiased input from a large number of participants. And very strong character of this technique is that it prevents the domination of a single expert, promoting a very balanced consensus. For our project, we used a modified version of the Delphi process to reach a consensus. We conducted 3 evaluation rounds in which the statements were anonymously reviewed and adjusted. In the first step, we conducted a systematic literature review and formulated a total of 62 statements and internally adjusted them within the LWA board. All these statements were sent out to the LWA founding members for an evaluation process. We used SurveyMonkey as a tool for this purpose. And during the 2 following evaluation rounds, we revised the statements based on feedback from the LWA founding members. We removed statements that did not receive sufficient agreement. And in the end, it resulted in 59 statements that were discussed and further refined at an in-person event during the Lipedema World Congress in Potsdam last year. Before the final evaluation round by the LWA founding members, an expert panel comment was added. And this comment was an addition to each statement created by the working group of the LWA board to avoid misunderstandings. So the first round was internally within the LWA board to refine the first draft of the statements, which meant that a group of 11 international experts worked on the statements, had about a month of time to comment on the statements. All these comments were analyzed for clarity, level of agreement, level of recommendation for inclusion, and finally modified according to the group's comments. Then, in the first official Delphi evaluation round, all these statements were sent out to a number of approximately 100 international experts, and we received comments from 53 LWA founding members. Again, we analyzed our statements for clarity, level of agreement, level of recommendation for inclusion, and considering the comments in the Delphi process, the statements were refined. 3 statements were excluded because the predefined cutoff was not reached. The second Delphi round followed, very similar. Here we had a response rate of 50 LWA founding members. Then the Lipedema World Congress in Potsdam took place, which meant that we could discuss on site the exact wording and details of every statement. This took place in Potsdam on October 7th last year, and we modified a number of statements according to the comments that were bring up to the panel. Last was the final Delphi evaluation round. Here it's called round 4. And today I will present on the preliminary results of this final evaluation round. So first, I will better explain the process of evaluation. We, for every statement, we ask 5 questions. First question was, is the statement clear? Second question, do you agree with the statement? And third statement, do you believe that the statement should be included in the consensus document? These 3 questions were the core questions that defined if the statement could be a part of the actual position paper or not. Additionally, we ask about the level of evidence and if maybe additional evidence is needed to make a conclusive evaluation of the statement. To assess the individual statements with these 5 questions, we used the 5-point Likert scale. 5-point Likert scale is basically pretty simple. You can agree or disagree with the statement, you can strongly disagree or strongly agree. Whenever we found the evaluation of agree or strongly agree, we define this as a positive answer, and an agreement level overall participants above 70% was defined as a minimum requirement for a consensus. In cases where the agreement ranged between 51 and 70%, the rating was classified as preference, and the statement in question was removed. The structure of the 59 statements was divided in 8 different areas. First area was definition and leading symptoms. Second area, pathophysiology. Third, epidemiology. 4, comorbidities. 5, impact on quality of life. 6, diagnostic approach. 7, treatment modalities. And 8, an outlook in the future. And for each of these basic areas, I will present a brief example of the preliminary results. But let's first have a look into the participants. And this is very interesting. In total, a number of 68 healthcare professionals participated in the 4th Delphi evaluation round from around the globe. We can see a dominance from the German-speaking countries, Italy, Spain, UK, and United States. When it comes to the actual profession, we see a dominance of surgeons, but still we have a variety of medical disciplines and medical professions, as well as patient representatives that participated in the Delphi evaluation round. When it comes to the years, the participant had experience with lipedema patient. The majority had at least 5 years or more experience in treating lipedema patients, researching on lipedema, or caring for lipedema patients. In total, we see that most of the statements could be refined in a way that it was very clear. So the mean level of agreement that the statement is clear was nearly 96%. When it comes to the level of agreement, we see that the majority of questions had a very high level of agreement, meaning mean of 91%. Same goes for the recommendation for inclusion in the final position paper. We have the same, approximately the same value of about 90% agreement. What was very interesting was the indicated level of evidence. Despite the fact that we have a very high level of agreement on the statements, we noticed that very low levels of evidence was stated by the participants. And in many cases, additional evidence to have a conclusive evaluation of the statement was recommended in 45% of the statements. So first example, how the results look. The statement number 5 from the area of definition and leading symptoms is move this one. Okay. The statement reads as follows: lipedema typically spares hands and feet of excess fat deposition. Below the statement, we added the expert panel comment with a brief number of references. So what is interesting in this regard, we have a very clear statement. We have a fact that is usually agreed on as far as I am concerned in my professional background, but still the level of evidence is quite low, 73%. Interesting. Example from the next area, pathophysiology. Here we have a statement as follows: several findings suggest that extracellular fluid volume might be elevated in lipedema-affected tissue compared to BMI-matched unaffected controls. Again, there's a brief panel comment highlighting the literature that supports the statement with evidence. This statement is obviously not that clear, only 88% agreed. And the level of agreement with the statement was only 76%. And this is what we also observe in the ongoing discussion. But as far as the Delphi method is concerned, this statement can be included in the position paper, but it had to be indicated that the level of agreement was only 76%. What is again very interesting, the level of evidence supporting this statement is indicated as very low. Another example from the field of epidemiology. Here, this is related to the biological sex. The statement says that lipedema primarily affects biological females. Occurrence in biological males appears to be possible but rare. Again, very clear statement in my opinion, but the level of agreement is only about 88%. So apparently the level of evidence is not as high enough for a conclusive statement. Example from the field of comorbidities. Several findings suggest that the prevalence of hyperthyroidism might be higher in lipedema patients than in non-lipedema populations with comparable BMI and age. And again, despite we have a very clear statement, the level of agreement is only about 72%. And here we have the one and only statement that did not reach the predefined cutoff of 70% in the first 3 questions. So this statement must probably be excluded from the position paper in the process. And here we see again that the indicated level of evidence is apparently very low, and 70% of all participants have the opinion that additional evidence is required for conclusive evaluation. Again, an example from the field of comorbidities. Lipedema might be associated with connective tissue disorders, such as hypermobility spectrum disorders. Clear statement, and the level of agreement is barely above the predefined cutoff, with an indicated very low level of evidence. The next example that I want to present to you is from the field of impact on quality of life. The statement is as follows: missed or delayed diagnosis or management of lipedema negatively affects a patient's symptom burden, mental well-being, and overall quality of life. Very clear statement. Well, very high level of agreement, or 100%. Every participant believed that the statement should be included in the document, but still, the level of evidence supporting the statement was indicated as medium. An example from the field of diagnostic approaches. Routine clinical exams should include standardized anthropometric measurements such as waist to height ratio, waist to hip ratio, and body mass index. Clear statement, level of agreement quite high, but the level of evidence supporting the statement is apparently not sufficient. Another example, the excess limb volume in lipedema is generally not associated with obesity. And here is it very interesting that only 75% of the participants have the opinion that this statement should be included in the consensus document, and the level of evidence supporting the statement was indicated as very, very low. Examples from the field of treatment modalities. The statement goes as follows: in cases where lipedema coincides with obesity and metabolic disease, it is advisable to prioritize treatment for obesity before considering lipedema reduction surgery. Very clear statement, very high level of agreement, but a medium level of evidence supporting the statement. Future directions, last area of our statements. The statement goes as follows: a comprehensive standardized case report form, CRF, should be developed to improve consistency in diagnosis, lipedema reporting, follow-up and research, and to facilitate, for example, both cohort and longitudinal studies. Very clear statement, very high level of agreement, but not everyone is convinced that the level of evidence is high enough to support this statement. So in summary, we have a very high level of consensus overall statements. We have low levels of evidence for many statements. We have a very high demand for additional research in a number of areas. And as far as research is concerned, high need for an agreement on key diagnostic criteria and standardized reporting is indicated. So this might be a future project, a standardized case report form that everyone could agree on within the Lipedema World Alliance. What are the next step of the Delphi project? Within the next weeks, we will compile a detailed analysis of the final results. The actual statements are fixed for the moment and no change of wording is possible when we are consistent with the methodology, but we can adjust the expert panel comments according to the feedback. And this is a process that we will conduct in the next 1 or 2 months. Following this, the creation of a position paper draft is intended, highlighting the methods that I explained to you in detail before, and of course, the presentation of the results for each and every statement. This position paper draft will be circulated among all LWA founding members to comment on the document in order to create transparency and to follow the democratic principles of the Lipedema World Alliance. After implementing all the comments and the feedback of the founding members on this paper draft, the final editing of the LWA position paper will happen. And again, before submission for publication, we as LWA will obtain approval from all participating LWA members before actual submission. And with this outlook in the future, I thank you very much for your attention, and I assume that you might have some questions. I'm very happy to answer every question that you might have.
Thank you, Philipp, for your wonderful and interesting brief overview of the Delphi process. There is an awful lot in all those statements. So thank you very much for introducing them to everybody. Do you want to maybe stop sharing while we just do the Q&A?
Yeah, sure.
Perfect. Means everyone can see.
The view on Potsdam is beautiful, but yeah.
It is beautiful. Potsdam is very beautiful. So perhaps the Potsdam Tourist Board would like you to put in a little vote at this point for everyone who didn't come to Potsdam and enjoy participating in the Delphi process should visit Potsdam and see where the Delphi process was undertaken. So people are, as you'd expect, very interested in when we will publish. So you've given an overview of a very collaborative process, including getting agreement from all the founders. And you had a very high level of participation from those founders, didn't you, Dr. Kruppa? So with over 100 founder members of the Lipedema World Alliance, that's a massive amount of people to get some support from. Would you like to start by telling us a little bit more about that? How do you get that many people to...
Yeah, I think this is the most important aspect of this project, to get as many people involved as possible. And we received feedback from 68 LWA founding members of approximately 95. I'm not 100% sure. So very high interest in this project among the founding members. And what I highlighted in the beginning of the rental section was that the professional background was very diverse. So when we are thinking about a publication and talking about the publication process, this is a strength of this Delphi paper, in my opinion, that we involved a very broad spectrum of opinions and perspectives. As far as the timeline is concerned, you indicated there might be question about the timeline. We want to follow the principle of democracy and transparency. So whenever we have a draft ready, this will be shared with all founding members, giving them sufficient time to comment on, to work through the document. We as a working group from the Lipedema World Alliance would also need sufficient time to consider all the comments that popped up. For every question, we gave two options to comment on. First was, is the statement clear, yes or no? And the second was, in the end, additional comments to the actual panel comments. So we have two possibilities to comment on every statement, which means theoretically one person could give 59 statements, 2 times a comment, making it very very comprehensive to deal with when you want to consider all the different perspectives. This is the reason why I cannot define a very specific time point when we will come up with a position paper draft, but I will expect it to be happening in the next 3 months.
Thank you, Philipp. That's still a very exciting agenda. So people might expect to see a publication perhaps maybe early next year?
Yeah, following the lead of what I outlined,
Yes,
within the next 3 months. So we are July, August, September, and September we have the position paper draft ready that will be circulated among the founding members, meaning they would need sufficient time to comment on, let's say a month at least, making it end October. Then we can again implement all the comments, which means that we would need additional time. Let's say by the end of the year, a final position paper document can be finalized. But when it comes to the publication process, this is something that would need, this would require additional time. So I assume having it published by the end of the year is very, very straightforward.
And it's very exciting. And I must actually say congratulations on all your hard work in this, because to coordinate an invitation for feedback from over 100 people does get you as you said, an incredibly diverse range of feedback. And that brings us to an interesting question, which is, you showed us a very interesting slide about the range of backgrounds of respondents that we had from amongst our founding members, which talks probably a little bit to the diversity of professions within the Lipedema World Alliance and within the sorts of areas in which lipedema has been treated. And one of the groups of participants was patient representatives. Did you find that the different kinds of communities of respondents, if you like, responded in different ways? Because that's just not something that we've talked about so far in the consensus, because we've been looking at it in how the whole group came together. But I wondered, did you have any thoughts on how the nature of the background of people who participated came through in the responses they gave you?
The nature of the background is very hard to categorize. Of course, it's easy to categorize between patient representative and medical professional, but within the medical professional community, it depends very much of the healthcare system that you're working in, making it complicated to have a comprehensive understanding of how the situation is in Brazil compared to the US and, for example, Germany. So all the categories that we offered were obviously not sufficient that all the participants found themselves in it. And we have 10 participants that categorize themselves as other type of healthcare provider. What does this mean for me? It's very hard to have a conclusive understanding of how the background might influence the opinions. Honestly, I did not separate the answers from patient representatives from medical professionals, but within the medical the medical professionals, it's complicated to separate the lymphologist from, let's say, the phlebotomist, which is in individual countries very similar area to work in. I hope this makes it clear what my thoughts are in this regard.
They're all very interesting, Philip, because I think something that's very important for people to understand about this process is how unique it is. You mentioned that other professions and industries like business have used the Delphi method to achieve a consensus, and that it has been used in other healthcare related settings. So there is a precedent for using Delphi to take a topic where there is such a great variety of opinions and so many different thoughts, and to come together to a truly democratic consensus. And this is, in that respect, a very unique project. I'm not aware that anyone else has yet done such an analysis. So I think you are to be congratulated for taking on, in the lipedema world, if you like, such a big task and such an interesting one.
I think this is a huge advantage of the LWA, that it gives medical professional representatives from all over the world the possibility to bring these opinions together to discuss within a positive-minded community. And of course, we will never find 100% consensus for each and every statement, but we can have an understanding of the main opinions that is present not only in a specific country, but worldwide.
Thank you. Something else that you covered in your slides, Philipp, was this interesting relationship, or sometimes a lack of relationship, between the level of confidence there was in agreeing with a statement and then the confidence there was in the level of existing published evidence. And I know that when you sent out various rounds of the Delphi analysis, you provided some very helpful indicators of some of that evidence to people by listing out a variety of papers that had been selected by the working groups for the reference of people responding. Do you have any further thoughts on that interesting relationship between the social confidence, if you like, that this was an accurate statement about lipedema, and yet the lower confidence in the levels of published evidence? Do you feel that that inverse relationship is because of some of the reasons you've talked about in terms of why we need this kind of consensus, because people's papers are done on perhaps different patients or in different ways? What more thoughts do you have on that interesting relationship, if I may ask?
Yeah, it's indeed a very interesting fact that relates to a number of statements. And what does it say for the disease lipedema? What does it say for our analysis? So first, it highlights the problem that we do have in lipedema research, that we haven't agreed yet on clear diagnostic criteria, that we haven't agreed on a standardized form of reporting, which directly influence the level of evidence. And I'm very proud that the LWA founding members are that open and honest to share that despite they have a clear understanding of the individual statement on lipedema, they cannot say we have super solid evidence on it, and there's yet a way to go. This is one of the main strengths of this position paper in the end, that not only the statement itself will be undermined with opinions, but also that there's a clear lack of evidence in specific areas that research need to focus on.
Thank you. And I suppose that's why in your presentation you talked about a case report form being something that you feel is going to be perhaps one of the next logical collaborative activities.
Yeah, that's true.
Please go ahead.
Yeah, that's true. There have been proposals regarding the case report form, and the problem is that still there's no standard. And the hope is that within the community that the Lipedema World Alliance might create, the research groups can get in contact, can be bring in contact, or can finally agree on a specific way of reporting their diagnostic criteria, their exclusion criteria, their criteria to categorize comorbidities, and so on. This is something that could be done in the future. Hopefully the LWA is way to do it, or a framework that can be helpful. to achieve this goal, but this is mandatory in the end to improve the level of evidence supporting all statements. We have to have in mind that this document is not meant to be fixed forever. This should be a living document. It should be amended each and every year, and new evidence must be implemented in the future. And it's most likely to be, or we expect an improvement in the level of evidence in many areas in the future, but it might be easier when we have this case report form, or when we have a form that we can actually agree on and that we use.
Thank you. So you talk about revisiting this document, which sounds very brave for something that has been clearly such a big exercise that has taken quite over a year, I guess, at this point to work through those stages. Can you tell us a little bit about how would it work to keep the concept of the consensus live and to refresh it?
The more the LWA is alive, the easier it will be to work on this document. So my hope for the future is that within framework of next LWA congresses, maybe in Rome in 2025 or wherever, interested LWA members can find together, form a consensus group, and proceed working on the document. This is nothing that should be handed over to individuals or to specific research groups. I think we must have in mind the diverse community the LWA can create, and this should be respected in this committee, in the working group. So my hope for the future is that it can be continued, and there are a lot of interested people to work on this document. We will see about it.
Yes, there are indeed many interested people, and it's been very, very valuable to participate in. I'm just going to pick up on something you said, which is that this process has been carried out by members of the Lipedema World Alliance, and we have well over 100 members from a variety of different sources, from healthcare professionals to representative organizations of scientists, researchers, and patient representatives. So some people who will watch this live stream won't be our members, and we're certainly very pleased to share this information with everybody, which is why we've chosen to do this in a very public format rather than in something restricted just to our members. So people might be wondering how they can join us, and I know you and I would be very glad to work with increasingly more and more people. So for anyone who watches this and is interested in joining us, they can go to our website, which is www.lipedemaworldalliance.com. She says, hoping that's right. And if they go to the website, membership is on the top of the page, and they can then click on how to become a member and fill out their application online, and then that'll be reviewed by the board. So we are very keen to increasingly get members from a whole variety of different parts of the community. We've got 100 already, and we're in over 20 countries, I think, if I'm right. But there's obviously more countries in the world and a number of other people. There were something like over 150 people, I think, Philipp, came to the Congress in Potsdam. Is that right?
The Congress in Potsdam?
Yes.
That have been over 500 people in total. So it was a first World Congress with that broad spectrum of perspective, and it was very interesting to experience the interest in lipedema, in research, and having so many different research groups present at one location. I really hope that we can continue having these lipedema congresses. And I totally agree with you, Kate. We will welcome every new LWA member. Join us via the form on the website. And whoever is interested in supporting us working on the position paper is free to contact me. Yeah, thank you very much.
Yes, indeed. Your details are on the slide, so anyone who's keen to contact you will find that even easier to do so. And anyone with any general feedback, comments and questions can also go to our website and can submit any information to us through the Contact Us area, and that will be shared with the board. So, and as you say, also, we hope very much to have another second Lipedema World Congress maybe next year. So it'll be really good to be able to announce more details on that in due course. As we sort of start to move towards the end of our discussion, something I would like to pick up on a little bit is that LWA collaboration between healthcare professionals, people with an interest in research, as well as people with an interest in clinical practice, and with patient organizations, because this Delphi process was open to all of the founder member categories to respond. And I think it's very interesting. When you were speaking a little while ago, Philipp, you said that you hadn't particularly analysed responses, for example, by respondent type. So what I would take from that is that the type of respondent wasn't immediately obvious in the feedback, that the feedback was all equally interesting and varied, whether it was coming from organisations representing patients or organisations representing professionals or individual professionals. And I think that's something that's really, really valuable about the LWA, speaking as somebody who is from one of the patient representative, if you like, national organisations that form part of LWA and part of the board, is that we are all coming to this process of the Delphi analysis as we're coming to other collaborations together, very much as equal participants with different backgrounds and experiences. And I think that's something that was very valuable. And it would just be great to have any other thoughts from you about doing this kind of process with patient representatives as well as with industry professionals, if you like, other healthcare professionals and researchers.
Yeah, this is one of the core benefits from the Delphi technique, in my opinion, that the anonymity prevents the domination by a single expert. This is something that I had on my slide, and this is also applicable to the domination of a single type of participant or a single type of healthcare professional from a specific area in the world. This is an anonymous process that gives everyone the same voice and the same possibility to participate in commenting on the statements. When we have a look at the numbers of patient representatives, we also recognize that there are only 10 representatives commenting on the statements and 58 healthcare professionals. So yes, the patient representatives are equal. They have the same voice as every healthcare professional, but the dominant opinion still comes from the medical community in these results. Without personal perspective on this, it's just a fact.
And I think we would expect that when we look at the makeup of the people who came together to found the Lipedema World Alliance, because the Lipedema World Alliance is what we would call an umbrella organisation. So the patient representative part of it is only open to people who are the representatives of national associations. And we would want a very large membership from people who are either researching or practicing clinically in treating lipedema. So I think to get that level of responses is very good and is very consistent with our overall organizational structure, I think.
Yeah, that's true.
So are there any other thoughts or comments that you would like to make having gone through this process? I guess the question I would ask you, Philipp, is, has something What surprised you the most, if I can ask, about doing that? Because there were a couple of statements that I know it was interesting, they didn't quite make the cutoff, and some other things. So when you're telling other people about what you've been involved in for the last few months, what do you say has stood out for you about getting to this stage in the Delphi analysis?
Honestly, I'm working in the field for some time, and I expected many of the core arguments to happen that actually took place, and there are still critical areas where reaching a consensus is difficult. But what surprised me was the demand and the interest in this project in general. So whenever I was participating in a medical congress or an event, someone asked me about the status on this project, and this surprised me very much. Apparently, there is a demand to formulate a position paper. Apparently, there is a demand to have a better understanding of the general perspectives in the field. And I ultimately came to the conclusion that this is just a starting point for the future to improve the research quality. Yeah, so your original question was what surprised me the most. It's not a specific fact or the reaction to a specific statement. It's just the overall interest and the will to participate in the process.
Thank you, Philipp. We've been having some interesting little conversations in the chat, and there's something that I'd like to ask you to talk about, which is where one of the patients watching tonight has commented that so many healthcare professionals outside those with an interest in lipedema have a lot less awareness of it. How do you see perhaps our work in the Concensus helping with that wider task of reaching other healthcare professionals? Because there's a lot that is taught in medical school, but equally there are a lot of conditions that are only touched on briefly. How might the LWA, whether it's through this analysis or other activities, really help drive that wider awareness? And how much would the Delphi help with that?
Thank you for this question. I think it's a very important one because I did not specifically get into the details who is addressed with the position paper. This is not nothing that is intended to be only read by the medical field, by the medical community, but also by policymakers, by nationwide consensus groups, guideline groups. And this is something that should be read by interested medical professionals, interested patients that want to understand about the true directions in which lipedema research goes and what lipedema might be. I very much the impression I got when I started working with lipedema patients was that it's very hard to obtain solid facts about the disease. And the more you read, the more it got complicated. And having such a document that is not a summary of studies that are hard to follow, but an evaluation of professionals with a special focus on lipedema might help a variety of stakeholders to understand about lipedema, to have a better better understanding of the facts when you don't have to search in social media. This is the intention. Statements are easy. Whenever you're interested, you can read the expert panel comment, which briefly summarizes the core studies in the field, and whenever there's someone who really wants to understand a specific topic, then this is not the document to read. Then the original papers is the literature that should be addressed. it is a summary of opinions, and it should help everyone to understand what lipedema might be.
I think that's beautifully put, Philip, and very, very illustrative of a very considered and collaborative approach. And I think actually it's a very heartening message that the consensus paper will be useful in conversations with the insurance organizations and healthcare structures in different countries, because you mentioned the fact that many of our members are from a variety of healthcare systems. And there's a very big study going on in Germany that I know your centre is part of, which we all very much are excited to see published and to see how the German insurance structure responds to that. But there are so many other countries with much, for many of us, much further to come. So to understand that this paper provides a useful topic for those political, economic discussions, I think is super helpful, because that's definitely been a gap for that kind of national and regional work. So that's very exciting. I know we could keep talking all night. I could certainly talk to you all night, because you are always faithfully courteous and considered. And I think you've given us some very genuine reflections tonight on what is an amazing undertaking. I've certainly felt privileged to be a part of responding to it, to bring the perspective that we had gained from our perspective in the UK and our experiences, and to see your own thoughts. And that's something that I know people are sort of saying has been a really, really interesting piece to see, and people are very, very keen to see our publication. So I know that's something that we will have to talk more about as we get closer to that wonderful date on all our social media and so on. Are there any other final comments you'd like to make, or any other sort of thoughts from you before we start moving to close the session tonight?
Again, I encourage everyone to be part of the LWA, to join the Lipedema World Alliance, because I think it's a very interesting project and could be a great framework to improve the healthcare situation for affected women. And the more participants we have in all our activities, the better.
Indeed, I very much appreciate that. And I think that's a wonderful note to end on. And I do, again, on behalf of everyone else in the board of the Lipedema World Alliance, and in particular on behalf of those of us in the patient representative community, I thank you very much for stepping up to champion this initiative, which is so needed for the reasons you've set out, and in taking on and giving up so generously so much time to get us to this place, because I think you've given us all some awareness tonight of just how labour intensive a Delphi is, because a genuine consensus is hard. As you say, there are so many different opinions, and sometimes all our opinions are based on our own, whether it's clinical practice or national context. And there are many different kinds of valid opinions. So to come to a genuine consensus is a very, very interesting and rewarding process. So I would like to thank you very much for that, and to truly say I stand in awe of your work in taking us through all these statements and finding out what we truly could all have a consensus on. And I would like to also finish by inviting everybody to be aware that we do have another session left this month, which is our colleagues Isabel Forna-Cordero and Thomas Wright. Those two doctors will be talking on Wednesday in 2 days' time, and they will be covering what we know about compression in lipedema, which is always a very popular and important topic, and also a very interesting recent paper by Dr. Wright on lipedema surgery and on the benefits that it has on range of movement, on reduced pain. And it's a really, really, Tom's work, I think, is really interesting. So two really, really interesting people, and we are super excited to see their session. And otherwise, we will shortly close our video. And again, I thank you, Philip, and I look forward to seeing everyone else back in 2 days. Please do share any final thoughts in our chat. We will go through them, and otherwise reach out to Dr. Kruppa or to the Lipedema World Alliance. So thank you, Philip.
Thank you very much, and have a great night.
You too.